Good afternoon, everyone. Today we are going to learn the treatment guidelines for anti-malarial drugs. So, malaria is caused by a single-cell parasite of the genus Plasmodium, which is Plasmodium falciparum, Plasmodium vivax, and Plasmodium malaria and ovale. Can you tell which is the most common in India? Yeah. Yeah. So for malaria, you before starting the treatment, you have to do the microscopy and rapid diagnosis test. You can't treat how you treat for antibiotics. Like without confirmation of the diagnosis, you can't start the treatment. So let us see what is uncomplicated malaria treatment guidelines. So we are using chloroquine 10 mg on day 1 and day 2. Then we will use 3 mg on the day 3. Yeah, 5 mg on the day 3. Sorry, thank you. And we are using Primaquine 0.25 to 0.5 mg per kg for 14 days. Before you are going to use the Primaquine, you have to see for G6PD deficiency. Anyone knows what is G6? Glucose phosphate deficiency. Yeah, so if you have not seen, then it causes the hemolysis. So patient may cause like fetal death and everything. And this chloroquine will be resident for 2 to 3 weeks in blood, thus prevent the first relapse. So the relapse will happen on the 3 weeks. After the 3 weeks, so you are treating this chloroquine along with the Primaquine to avoid the relapse. So if you are using the Primaquine, you have to look for monitoring parameters. It is discolored urine, yellow conjunctivitis, abdominal pain, nausea, and vomiting. If you see any of those symptoms, then you have to stop the Primaquine. And Primaquine is contraindicated in pregnant women. Next one is like Plasmodium falciparum. This is chloroquine resistant, but this is not chloroquine resistant, so we are using here. And this in this Plasmodium falciparum, you are using artesunate based combination therapy, that is ACT-SP. Artesunate for 3 days, 4 mg per kg you are using. Sulfadoxine for 1 day, 2.5 mg per kg. Pyrimethamine for 1 day to 1.25 mg per kg. Along with this combination, you are using Primaquine 1 dose on the first day of the treatment, that is 0.75 mg per kg. This is having a gametocidal action. Whatever the gametes has been produced by the plasmodium, this parasite, it will kill those. For this is the treatment, and this is for northeastern treatment state. So when I say northeastern, it is Arunachal Pradesh, Manipur, Meghalaya, Mizoram, Nagaland, and Tripura. So apart from this, remaining states will be this is the treatment. So you're eating, so you're giving Artemether 20 mg plus Lumefantrine for 20 mg along with the Primaquine, that is 0.75 mg per kg for 7 days. So in pregnancy, first trimester you are giving quinine 10 mg per kg TDS for 7 days along with clindamycin, that is 5 mg per kg for 3 days. When I say mixed infection, it is nothing but as Plasmodium falciparum and along with Plasmodium vivax. So you are using the same treatment this along with the Primaquine 2.5 mg per kg. So did I miss something? Yeah, for the complicated severe malaria, you are using IV, IM. You can use IV or IM for 24 hours. Artesunate 3 days until the patient can tolerate the oral dose. So then you are giving 3 days ACT along with Primaquine. The criteria for when you are classifying, like when it's called as severe malaria, it is called the mnemonics is calf's shape. So here the C is consciousness, acidosis, renal impairment, B is bleeding, seizures, S is shock, hyperparasitemia, anemia, and prostration edema in lungs. So when you see these criteria, then you're going to identify that it is a complicated severe anemia. This is the treatment. So there is something called as reoccurrence. So when it's reinfection and treatment of the failure. So if it's in 28 days, then it is called as recurrence. That is nothing but you're treating with 7 days of treatment with artesunate or quinine. For doxycycline, you can use doxycycline or clindamycin. If it is reinfection with after 28 days, so the treatment will be ACT and SP. The guidelines. Yeah, chemoprophylaxis is recommended for the travelers, migrant laborers, and military persons who have been exposed to the malaria. So their short-term chemoprophylaxis, that is less than 6 weeks. You're using doxycycline 10 mg in adults. And 1.5 mg per kg body weight greater than 8 years in the children. For the long time chemoprophylaxis treatment is after greater than 6 weeks. It's mefloquinine 5 mg per kg body weight up to 250 mg you can use. And this doxycycline is contraindicated in pregnancy and lactating women and children less than 8 years. So this mefloquinine is contraindicated in the cases with the history of convulsion, neuropsychiatric problems, and cardiac conditions. Yeah, thank you.